Hello, Matthew Bell with Alzheimer'sProof.com, and today I wanted to tackle the coronavirus. Now, it's not obvious that the coronavirus has any real connection with Alzheimer's disease. The reason why I wanted to tackle it is because it's actually an issue for people whose loved ones reside in a long-term care facility or a nursing home. And so I thought it would be good for me to just say a few words about it. I don't anticipate saying anything fairly earth-shattering, but I'm trying to bring some news items to your attention and maybe just a few tips to help people to deal with seasonal illness and in specific this novel coronavirus that has presented itself to the world called COVID-19. So in an article in the New York Times, the title of it is quoting from somebody that was interviewed, and it's "When Will It End?" It has to do with a long-term care facility in Seattle where there is an epicenter of suspected and, I guess, demonstrated coronavirus. Now, when I started looking at this, I think the death total was around 4 as of the time of this recording. It looks like it's gone up to about 9. But the real issue that I wanted to make of this particular article is just pointing out that this is happening in a long-term care facility. And part of the reason for that is predictable. You've got people living together in close proximity. Many of them are immune compromised or otherwise elderly. They have maybe other health issues going on. They've got family members coming in and out to visit them. And there's a very high risk of not only exposure in a situation like that, but also the ability of the disease to spread person to person, especially when people are eating in common areas, dining halls, cafeterias, and the like of that. Obviously, this is one of the reasons why schools often have a quite high outbreak rate, because there are all these kids going to school and eating and so on in close proximity to each other. And there's another commonality as well, that children's hygiene might not be the greatest, and in a similar way, when you have an elderly person who's suffering from a cognitive impairment, it is possible that their hygiene is not going to be the best as well. Now, according to an article in the Kaiser Health Network, approximately 2.2 million people are living in long-term care facilities right now. And one of the main things that I wanted to point out is there's really only 3 strategies, I think, that are fail-safe. Now, of course, you're going to hear to get the seasonal flu vaccine. And I know there are certain interventions like Tamiflu that are often prescribed for the flu. But there's really 3 main ways to try to raise the probability that a person is going to survive the flu and simultaneously lower the probability that a person is going to be susceptible to, come down with, or otherwise suffer from seasonal viruses, including influenza, common cold, and presumably coronavirus. We'll get into those, we'll unpack those in just a minute, but they're essentially going to be diet, hygiene or sanitation, and also quarantine is going to be the third. Just keeping distance, whether you yourself are suffering from it, keeping distance to not spread it, or if you are not suffering from it, keeping distance from those people who have it. So the first thing that I'll say is that the symptoms of the coronavirus, according to the research that I did, looks like in general they're going to be fever, cough, and shortness of breath. However, what they point out is that this virus being a novel virus is actually, I guess, a technical term. I am not a medical doctor. I am not a medical researcher. I should add that. This video is for general informational or entertainment purposes only. This is simply research leads that I'm recommending to you. I am not speaking definitively and certainly not authoritatively on any of these subjects. But the idea of it being a novel virus, according to some of the articles that I looked at, looks like the implication of that is that we're really not sure of the total constellation of symptoms, and they're also not sure of mortality or morbidity statistics, which they do have fairly good handle on, let's say, for the common cold or the seasonal flu. So there's a lot of scary things going around. I know the stock market is going down, supposedly because of scares about this. Many people are concerned. There's been calls to shut down airports. There's been calls to cancel classes and things like that, just in order to try and prevent people from assembling in places where there might be an exchange of these kinds of things. And it does spread through droplets in the air, so it's airborne virus, respiratory primarily. Whereas the seasonal flu apparently averages about a 0.1% mortality rate. With this virus, the estimates are between about 1 and 2% or higher. And in the elderly population, which is again another reason I'm bringing it to your attention, it can be even higher, so approximately 10, possibly as high as 15% in various places in China where they had some of the statistics, because this is where, at least it is believed, the epicenter of this the actual breakout of this occurred in a province in China. Now, how good the information is coming out of China, how reliable it is, I can't say. But it's for sure that there are challenges in a long-term care facility, especially to a person who's cognitively impaired. Because again, hygiene, sanitation is likely to slip, diet is likely to be somewhat bad. They're not likely to remember to not associate with certain people, maybe. They're not likely to remember the kinds of things like covering their mouth that are going to try and facilitate the seclusion of the virus. And according to another article, this one by ABC News, for these reasons, older adults may bear most of the burden. Now, there's a couple of things that you can do. The first and primary thing, again, hand washing, sanitation, they're going to be very important, so making sure to keep surfaces clean. If you know that a person has a particular virus, hand washing, preferably in soapy water, but hand sanitizer does also work in a pinch. But for 20 or 30 seconds, it's often recommended to sing something in your head like the Happy Birthday song, just in order to get a fix for how long you should be washing your hands. So if you're washing your hands for less time than it takes to sing Happy Birthday to yourself in your head, I'm presuming you're not doing it out loud, then you're not washing your hands long enough. That's the idea. Here's another one, and this one is somewhat odd to think about, but if you're touching, let's say you're in a public restroom and you're touching the faucet with your hands, and then you wash your hands, and then you grab the public faucet again, and then you grab the door handle, you might be reintroducing things onto your hands that you just washed. So some people recommend taking a paper towel and turning the water off with the paper towel, opening the door with the paper towel, and this is essentially designed to try and prevent you from reintroducing germs or material onto your hands after you've just washed them. Now, another one is going to be covering your mouth. Now, if you're out in the air and you have no one around you, covering your mouth is probably not only unnecessary, but it may also cause the germ material to be on your person. But if you're around other people, covering your mouth when coughing or sneezing or yawning or expelling any kind of air that might have water droplets in it is going to be very important to cover your mouth and your nose. So sometimes people will say, well, don't use your hand, because if you use your hand, you're going to be touching people, touching surfaces, shaking hands. So cough or sneeze into the crook of your elbow. I mean, it's about the best you can do. Another option would be to carry some kind of a cloth perhaps with you, but even there, if you're touching it, it may be necessary to wash your hands afterward in order to really try and minimize the spread. If you think you're sick, obviously the best thing for you to do would just be to separate yourself from other people to the extent that that's feasible. If you need medical care, then this is not going to be feasible for you. But if you are a caretaker for your relative, it may be necessary to simply forego that visit, even though it's vital for their health overall, even though it's vital for maybe your personal well-being, your mental well-being, their health, their well-being. I get all of that, but it's a similar thing, I think, to when you're in an airplane and they tell you if the airplane crashes, and thank God, knock on wood here, I've never been in an airplane crash, but they'll tell you secure your air mask first before helping people around you, including children or whatever. And the idea there is you have to take care of yourself. You're going to be of no use to your loved one if you introduce coronavirus or influenza into their care facility because you simply felt it was necessary to visit them on Saturday instead of on Monday when you were fever-free for 24 hours. So that, I think, is a hard pill to swallow, but I think it's probably a necessary one. Keep your distance if you are not well. The other thing is understand that 24-hour period. So usually you will hear something like you need to be fever-free for 24 hours before you can be reintroduced into a group setting or community setting. And just to be clear, this is naturally 24 hours fever-free. If you are taking fever reducers like Tylenol, that doesn't count. You can't just say, well, my fever's gone because I took Tylenol the last 8 hours. Well, the fever isn't gone particularly as it has been suppressed. The fever needs to be naturally gone because it's your body's way of raising the temperature to make it inhospitable to various germs, and it's an indicator of an infection. It's also supposed to slow you down. I mean, the body presumably is trying to put you on notice that something's not right and that you may need extra rest. So pay attention to your body and listen to it. A final thing with respect to washing the hands is to make sure you clean under the nails, because there can often be virus, bacteria, and other material that can collect under the nails. So if you don't do a thorough job washing your hands, including that area, you may still find that there's enough Doesn't take but 1 or 2 virus particles or bacteria in order to generate an infection. So once again, stay away from people if you think you might be infected. Obviously, international travel is a hot button here. It probably doesn't apply to most people, but if you are coming from an area that has just previously had an outbreak, probably a good idea to quarantine yourself for a little bit of time just in order to make sure that you're in the clear. So sanitation, quarantine, I really haven't talked about diet. Now I get into diet in other places, and it does turn out that there's a lot of overlap between the general healthy mind diet and some of the dietary measures that are going to be important for trying to maximize immunity. So one takeaway from that, just on the surface, in my opinion, is going to be that one of the foundations of basic human health, whether it's mental health, physical health, immunity, is just going to be a good diet. And the principles of a good diet are going to translate over into many different areas of your life. So for instance, foods that help to improve your immunity are going to be green leafy vegetables, fruits, including citrus fruits, cantaloupe is good, pineapple is good, strawberries are high in vitamin C. Vitamin D is going to be another vitamin that's going to be essential for healthy immune system function. You're going to get it, your body produces it when it's exposed to sunlight in moderation, but it's going to be present in dairy products and eggs, in certain fish. Then there are other things you can add in. So mushrooms, for instance, there are going to be a whole slew of mushrooms that are going to be mentioned in this regard. Some of them are going to be maitake, reishi, shiitake, and also something called turkey tail, which is a mushroom that's actually packed with materials that are supposed to help to improve immune function. On top of that, I have a soft spot for herbs, so I'll just list a few herbs that might be of benefit to you, and this is in addition to just basic nutrition, basic vitamin supplementation, like for vitamin C, vitamin D that we mentioned earlier. Vitamin E is another one that can actually be brought in because it is a powerful antioxidant. But some herbs are going to be things like astragalus, elder, echinacea, ginger, golden seal. I'll throw in garlic, olive leaf, oregano. Oregano can actually come in oil form as well as capsule form or leaf form. Turmeric is another one. Turmeric is on almost every list that I've generated with respect to herbs. I love turmeric. And the fifth one I'll add really isn't an herb so much, but it's vinegar. And in its apple cider form, it's probably the most palatable and even the most effective. But vinegar is an excellent antiseptic. You can use it as a gargle. You can even drink the stuff if it's diluted in water. You won't want to drink it straight or a whole lot of it, but a tablespoon, maybe, and 8 ounces of water, going to help to relieve throat irritation. Can also kill various germs that might be in the throat if you gargle with it especially, and it can also be a good thing for digestion. Now there's a lot of scary things, again, thinking about the coronavirus in particular. There's a lot of scary news reports and things like that, but I just wanted to add a few things. Certainly it's something to be concerned about, and it does appear that it might affect elderly persons and persons with compromised immune system to a higher degree than other people. And that's, of course, I think of interest, especially to my audience. But another thing I do want to add, maybe just as kind of a cautionary word, is, number one, a lot of the information is coming out of China. And as I kind of said earlier, how reliable it is, I don't know personally. So I would consider that. Second is, even according to some of the information that is coming out of China, no fewer than 80% of the cases are, quote, mild, meaning that the vast majority of people are going to have coronavirus, even if they are exposed to it, and they get it, they have symptoms of it. It's going to be so mild that they might not even seek treatment, or if they do seek treatment, it's not going to amount to anything. Once again, even though the mortality rate on the coronavirus is supposed to be higher than the seasonal flu, so if the seasonal flu is 0.1 and the coronavirus is, let's say, 1%, that is a significant increase, but still it's 1%. So out of every 100 people with the coronavirus, 99 people are going to survive. Now again, mortality statistics are going to change depending on the age bracket, and I get it, but what I'm saying is there's no purpose in worrying about it. Plan for it, yes. Prepare for it, yes. Try and improve your immune function, absolutely. But worry about it, I wouldn't. And the final thing, maybe this is a somewhat controversial point, but the Centers for Disease Control, which is based in Atlanta, started as a monitoring service to try and determine the level of threat to U.S. troops stationed at various places in the world where there was malaria-carrying mosquitoes. Now, after World War II, essentially the agency had absolutely no reason to exist. Its funding was going to be cut, and it was simply going to be disbanded. So it rebranded itself in 1946 as a general pathology surveillance unit. In other words, it was going to monitor the United States in order to try and keep track of various infectious diseases. in order to help give people guidance on how to stay healthy. So the thing that to keep in mind with respect to the CDC is its funding depends upon it ringing alarm bells. Now, it doesn't mean that it's wrong. It doesn't mean that there's no threat whatsoever. But the agency is literally paid to ring the alarm bells. And it does this every year. When I was a kid, I remember the hantavirus. There was monkeypox. There's been SARS and the bird flu, avian flu. And every year there's something. And the whole point of this is if there weren't something every year, I think people would start to scratch their heads and say, what are we paying the CDC for? So I think the CDC has to have something to point to every year. And I would just simply add that just as kind of a corrective to some of the panic-stricken news reports that I've heard. This is the CDC's job to point this out. We pay them to do it. We're scaring ourselves with information about the existence of a virus. There are viruses every year. So the best you can do, I think, is try to maximize your diet, optimize your diet for health, try to implement and practice good hygiene, good sanitation, and thirdly, just use common sense. If you are sick, stay away from people, especially people with compromised immunity, and if you know somebody else is sick, stay away from them, unless, of course, it is your job to provide health care. So I hope something I said was of use to you in this video. I know it was kind of off the beaten track from some of the things I usually cover. I am in the process of doing investigations on various sugars, and it has just been a monumental research task. But for the present time, I think if you found something of use in the video, I do ask that you like it, subscribe to the video, click the notification bell to be alerted to new content as it becomes available. I thank you so much for joining me today, and I look forward to seeing you again in another video. Stay healthy.